whether you're pursuing a fertility treatments or not. And, we briefly touched on age, but I always say, unless you're hiding a time machine in the backyard, we can't change that factor. But diet, lifestyle, environmental exposures in the 3, even 6 months, depending on other things that you might be working on, maybe even 12 months lead up to conceiving, is something that we can modify, and we can help to improve not only our chances of conception, which research shows 5 simple dietary changes can enhance fertility and conception by 69%. And if you're not ovulating, that goes up to 80%. So it's huge impact. And we absolutely see that in our practice. But as well, it's that follow-on, exactly what you said, of into pregnancy, and also just that confidence of when first trimester hits for so many, where symptoms are at their peak and things are hard to keep down. It's just knowing that you've done a lot of the good groundwork prior to conception can just give you that sense of peace as well.
I think that's an important point. I like to fill the tank, as I said to my patients. It's, it's almost like running a marathon. You are growing a new human being. So, and this is where supplements can come into play. We're not just fueling your life. We're not just making you vital and healthy. We're fueling the growth of a new human being, which really requires above and beyond what you would normally need to keep yourself healthy. So I've seen a number of women in their second pregnancy, and that I feel so much better because their tank was full. They had those great reserves to fuel that growth and development right the way through the pregnancy. And that's why this preconception period, as I think all 3 of us are really attesting to, is so important. And you can make those changes. Yes, age is a factor, but I'm similar to you, Stefanie. It's one factor. There are so many factors involved in producing healthy eggs. So let's not focus on that factor, because we can't change it. So let's focus on everything we can do to make those improvements. And I'm talking a lot about egg quality in my presentation, so I won't talk about it there. But I think the prenatal supplements and the prenatal nutrients that are needed. I don't know about you guys, but I sort of have my top sort of 5. I think we need folate, choline, which I think a lot of people aren't aware of now, which is, I think the American Medical Association have said that they should be in all prenatal vitamins because of its role in neural tube development and brain development. So that's one to look for. Vitamin D, as you're saying, Stephanie, healthy levels double your chance of pregnancy in studies. So, and I see a lot of women deficient. So getting your blood test, vitamin D. I like to look at B12 as well, which I think is the forgotten nutrient in the trifecta of iron, folate, and B12. And of course, your iron, which we hear a lot about. And I do see, I know about you, Stefanie, see people over supplementing with iron in some cases. That can cause constipation. You've got to be careful which form and which dose. So I look for an iron amino acid chelate, which is gentler on the stomach, because you do want to get that good uptake, but it is a heavy metal and you can take too much of it if it's constipating you, if it's causing your stomach to be upset. It's not in your bloodstream, is it? It's in your gut causing issues.
Yeah. And as well, like there is so much to say of just doing a simple iron test with your GP or your fertility specialist, because there are circumstances, not very common, but it happens where you get extremely high iron levels, and you don't want to be supplementing on top of that. So don't supplement blindly. Just have a conversation with your doctor, get some tests first.
That's
and
exactly
then go
what
from
I was
there.
going to say. I think we should encourage our patients to speak up, because some of them just go do some Google searching and start all sorts of different things and don't realize that there is A, the right amount, B, a balance, and C, not everything's going to help. So when I see my fertility patients, I usually do a baseline fertility screen, and that would include all the above. You would check for another forgotten thing besides B12 and folate for some people is to check for celiac disease.
Yes.
So I usually do a screen to check their full blood count, to check their iron, to check their vitamin D, to check their thyroid function, to check to see if they have celiac issues. So you just check a whole good basic screen to then see, as you said, what's missing and what you need to fill in the tank. And my top advice is a good quality prenatal. And I don't think a lot of patients are unaware that not all prenatals are
the same.
equal.
Yeah.
Yes.
Correct. So it's important to know you need a good quality prenatal that has all the above, as we said, enough folic acid. And if you have certain conditions, as you know, that preclude absorption, you will want the methylfolate or the active folate or the folinic acid rather than just vitamin B9 or folic acid. However, you need at least 400 micrograms of folic acid for adequate neural tube development, along with choline, as Tasha said. However, keeping in mind that some patients who are heavier with a higher BMI or who have insulin resistance or diabetes or are taking medications for epilepsy or other medications that can affect absorption need a higher dose. And I think while we're talking about higher dose supplementation of folic acid, it's also important to mention that there are some studies that have come out suggesting high dose folic acid throughout pregnancy increases the risk of autism. So I usually tell my patients that at the end of 12 weeks, once neural tube development is complete, the excess folic acid can stop. Then you go back to your normal prenatal supplement. So I think, I cover all of those. And then I also think, I agree, the antioxidants, so the vitamin C, the vitamin E, for the blood flow to the lining. Important to also remind my patients that vitamin E, there's some connection with cardiac issues in fetal development. So we usually stop that on a positive pregnancy. And then moving on from there, I also recommend omegas and, especially EPA, DHA, the right sort of anti-inflammatory and omegas. And initially for anti-inflammatory purposes, for blood flow to the lining, but then very importantly, later in the pregnancy for baby's brain development.
Yeah.
So, I usually tell them that as well. And then I agree, vitamin D, very important. Iron, very important. Patients need to tell us if they're constipated and not suffer on their own, because different forms of iron really change it for them. I'm sure you might agree. So they are usually the sort of important groups that I tend to touch on. And with the folate, just one last thing, as Tasha said, B12. I mean, we know folate is a B9, it's a vitamin B derivative, but there's a lot of evidence on B complex, so 6, 9, 12. To reduce your risk of miscarriage. And now there's a lot of evidence looking at NMN or NAD, which is also a vitamin B derivative for anti-aging and cellular function.
Yeah.
So
it's so important.
My sort of little package for their prenatal supplements.
Yeah, I know.
Absolutely.
Yeah.
Anyone knows my prenatal I developed when I was wanting to conceive, because my background was in product development. And I'm passionate about, as you said, Manny, about the nutrients getting to your bloodstream. So when I was wanting to conceive, I did so much research, as we all do. I think when we're wanting to fall pregnant, I was on PubMed and I ended up emailing the researchers from New York to Italy to say, why did you use certain nutrients in that research? Why did you use certain doses? And what I was finding out was really beyond what was available on the market at the time. So, that's where Natal Nutrients came about. I just wanted to put everything that I kind of for what I wanted to help me conceive into a supplement with, as you said, the activated nutrients, the iron that's not going to constipate, that's going to be well absorbed into your system, and the choline that I wasn't at the time being able to find anywhere, and I was seeing in the studies. So really important to look for a brand and to understand, and also to reach out to a professional, as I'd see someone like Manny, to get all your bloods done. I've seen patients come to me after 5 years of trying who haven't been to someone like yourself, Manny, and haven't had these basic nutritional workups done that can make a huge impact. So do see a professional. And the fuel that you're providing your future baby right now, because you are nourishing your future baby right now, those eggs are already there. So the fuel you're providing has such an impact that I kind of equate it to a car. We wouldn't put poor quality fuel into our car and expect it to fire on all cylinders. And I'm not particularly a car person, but I get my car serviced. I wouldn't think to fiddle with the brake fluid and pop some oil in there and just give things a go. I could probably YouTube it and do all right. But for some reason, we think that's okay with our bodies and our fertility. As you said, Manny, we Google it, we YouTube it, we go, oh, I'll add a bit of this, I'll add a bit of that. But you can take too much and it can be harmful. You may not be getting enough. So go and see someone, get the blood test done, and get your proper check-in that we should be doing for ourselves. We don't put enough importance on that.
Yeah.
So,
just to add to the nutrients that we've just been discussing, I think iodine is one of those ones that's often just slips under the slips under the radar. But iodine is such an important mineral for optimal thyroid function. And if thyroid function is inadequate, particularly hypothyroidism or subclinical hypothyroidism, which is pretty common, especially in females of reproductive age, that can throw out your ovulation, can throw out your menstrual cyclicity. And then as well, iodine's critical for the brain and intellectual development of the baby. And on top of the omega-3s that you mentioned, Manny, which I'm so passionate about making sure that everyone's getting sufficient omega-3s prior to and during pregnancy, is there's been some research showing that omega-3 status early in pregnancy and even preconception can help reduce potentially the risk of preterm labor and early delivery. So obviously it's a very complex obstetric situation, but anything modifiable that we can do to maybe reduce the risk of pregnancy complication as well can be done. And yes, you can absolutely take too much of stuff or blending things in the wrong combinations. I see a lot of, like, I'm taking this with this. It's like those two things aren't friends. You're not going to absorb either. So it's just expensive and it's not working for you. So sometimes it's also about the timing and when you take things, how it blends with your medication. So speaking to your professional about that level of specificity. It seems very specific, but you need to make sure that you're getting the most out of as well what you're purchasing, and your body is maximizing the absorption of that as well.
And also good blending, like taking enough vitamin C with your iron to help absorption, for example. And actually, before I forget, the one thing I would add to that I've added now to my list of preconception nutrients or supplements is a probiotic. So as you know, there's a lot of evidence surrounding healthy microbiome, whether that's in your gut or in your endometrium for your general health. And there's a lot of research in the field at the moment for microbiome health and fertility. So I usually tell my women to get a women's microflora or certain brands, as you may both want to elaborate on, with the right lactobacillus, right 4 or 5 strains of lactobacillus in it, which helps implantation. And in the 3rd trimester, I put patients on a pregnancy and breastfeeding probiotic, because that balances things not only for breastfeeding, but there's now evidence to show that it reduces allergies and eczema in the baby. So that's another big group that I have added on now, which you may want to elaborate on.
Absolutely agree. I think there is so much interesting emerging research in the arenas of both gut microbiomes, but also when we ever say the word microbiome, we think of our intestine, but it's not always the intestine. We've got vaginal microbiomes, we've got uterine microbiomes, we've got breast milk microbiomes, we've got skin microbiomes. We have microbiomes everywhere. And so if there is something a little bit out of balance there, potentially, I guess it's the kind of unseen part of fertility. I was reading a really interesting study the other day, and it showed that the people that were being less successful with IVF in terms of implantation failure, that when they did a vaginal swab, that I think it was in the 40% of some of them had bacterial vaginosis, which is just a general term for dysbiosis or an imbalance in the vaginal microbiota. And with a relatively simple treatment strategy, that can be overcome. But as well, a probiotic can really be helpful in preventing that developing. And it's really subject to different hormones that's going on throughout your cycle, hygiene, other things outside of that as well. So yeah, a really great probiotic that has a big focus on lactobacillus, because that will help reduce the pH of the vaginal area to help with keeping pathogens away. So trying to outcompete those bad guys from inhabiting and maybe causing some issues in terms of particularly around implantation. And the good news is, because my clients always freak out, they're like, Steph, do I have to stick something up to get it going? The good news is the oral probiotics do work via the gut to help modify the vaginal microbiome. So that's the good news. You don't have to do any pessaries or anything like that.
And just on that note,
and they are so someone has asked, are there certain brands of prenatal that you can recommend, especially if they have PCOS?
Obviously, I'm reasonably biased because I know exactly what's in my prenatal neonatal nutrients. I guess has everything that we've talked about in there in well-absorbed forms and great tolerability, low excipients. Particularly PCOS, I think there are other supplements you may want to look at. I know with Stefanie, probably the same. Naturopaths and nutritionists, I feel, have great success with PCOS. I love seeing my PCOS women. I'm seeing 3 through pregnancy at the moment, because if we can help you get that ovulation happening, if we can help improve that egg quality, which is relatively simple strategy. So I don't think it's just a prenatal. I think a good prenatal is a good baseline for you. But if you have PCOS, get some support. I'm sure you have wonderful results.
Yeah, I think it needs to be customized, and that's why we offer like supplement consults. It's kind of like a matchmaking service between your medical history, screening for those key diseases that Manny mentioned earlier that may require that additional dosage of folate, looking at your medications, looking at what you're currently taking, just a brief understanding of where your diet is. So if you're vegetarian or you're vegan or you hate fish, all those things come into play when it comes to designing supplementation plan, because you may need more omega-3s because you don't eat any salmon at all because you don't eat fish, or looking at your blood work and then looking at any background conditions like PCOS or endometriosis or thyroid dysfunction and complementing that out, because yes, you probably may need a couple more things than just a prenatal, but it's an absolutely great place to start, and you can slowly kind of build up over time, but definitely see a healthcare professional after you've done some blood works with a doctor. Absolutely.
Yeah, so get your blood work done, find out where you are. And myoinositol is one I do find, there's excellent research around in regards. In PCOS, I know, look, there's a double-blind study I was reading recently. It had more mature follicles, more eggs retrieved, and more good quality embryos when used in PCOS. So there is support available, particularly with that insulin resistance. I do find I use about 3 to 4 grams a day of a powder normally, so that you can get a good intake over the day. Pop it in your water bottle, drink it over the day. Seen excellent results with that with women with PCOS, and it helps to curb cravings, sugar cravings. I had one patient say, "What's in that stuff? I don't feel like eating sugar anymore." And like, exactly, because it's helped to balance that craving, that spike in blood sugar that was causing those cravings for you. So that's a good one for PCOS.
Yeah, and just a little note about PCOS, sorry, Ella, is that there's so much that we can do, whether it's you should see someone, nutritionist, a doctor, everyone in concurrently, because as you know, with PCOS there's a lot of preparation that goes into the preconception phase. So even if you're not ready to have a baby, you want to look at your diet, low GI, unprocessed, you want to look at your exercise, your weight, your insulin resistance. So there's so many things that you can start with just simple lifestyle management and a few supplements. And sometimes that alone may help regulate your BMI and regulate your ovulation. However, if that doesn't help regulate your ovulation, then of course start a good quality prenatal to start looking into pregnancy planning. And if Tasha and Stefanie have tried everything and you're still not ovulating, then you'll end up with me for ovulation induction. However, that pre-workup would have been essential. And then there are a few additional supplements, as you know, that we do use. And one of them Tasha's mentioned that I was going to talk about, which is the inositol or myoinositol. And not only is it an insulin sensitizing agent, so it works by reducing insulin resistance, but as we said, it also helps with egg quality because it has antioxidant properties. So it is very important from that point of view. And the other thing that we are currently researching besides cellular anti-aging for NMN and B group vitamins, NAD is also an insulin sensitizer. So watch this. There are so many supplements coming up that may be relevant for patients with PCOS that can be discussed with looking at your individual situation.
And definitely to complement the treatment. I know there's another one, N-acetylcysteine, using that with letrozole. It's actually getting better outcomes, particularly when we're with PCOS, and that's N-acetylcysteine. That again, I like my powders. I like popping in your drink. Between 600 and 1,200 milligrams a day in this study showed better outcomes of the ovulation induction. So yes, that's why we're all here. We love working together. If you need the ovulation induction, if this is either you don't want to wait or you can't afford to wait, ovulation induction is great. What can we do to make that most effective for you? So first time round.
Yeah, absolutely. And a lot of these medications require dietary and lifestyle support strategies alongside them, letrozole, Clomid, and so on. And as well, I think you just fare better throughout the process, mentally, physically, having some additional support around lifestyle as well.
We've got a few questions, and that we were talking about the types of foods before, and we're talking about whatever you were giving your patients, Tasha, that they weren't having cravings anymore. So I've got a question about eating unhealthy foods and also taking supplements. Do they counterbalance each other? Can you still, or do you have to change your eating habits so the supplements work, or are you able to still have your pastas and your cookies and creams and maybe your McDonald's on the side? What's the deal with the diet and what you're actually able to eat?
It doesn't mean a totally restrictive diet. So I don't think, I say for me it's the same. I don't think you need to come to us and think we're going to make you eat salad every day. That's absolutely not the case. We really want a whole rounded diet. We're not going to take everything off you. We're just going to really balance it. And look, I guess to your question, can I eat McDonald's and supplement and that'll be okay? No. So we do need to look at the diet, but I think there is a concern going to a dietitian or going to a naturopath. You think, oh yeah, they're just going to make me eat salad. I don't know about you, Stefanie. I don't make anyone eat salad, so don't worry. There are lots of things you can do, and I guess the prime things we like to do, omega-3s are fantastic right throughout the pregnancy. I know there was another study that a high dose of omega-3s implemented at the time of normal ovarian decline as we age actually help to mitigate that natural decline. So omega-3s are so important. I love to push more in that pushes the bad stuff out. So look at colourful fruit and veggies. You've got your lycopenes in your reds. You've got your anthocyanidins, which are great antioxidants, in your purples. So I'm big on getting colourful fruit and veg. Focus on whole foods as much as possible. Focus also on seasonal vegetables, because these days they can be shipped frozen thawed from who knows where to get that maximum nutrient density. So it's all about, as Stefanie said, tweaking your diet to make it, and I think we make it easier for you to follow the diet, because it doesn't need to be restrictive. If you Google, you may end up, I've had patients, I'm sure you have too, come to me eating almost nothing because they're scared, because they've read that I can't eat organic, I can't eat gluten, I can't eat lactose, and they just come to me eating next to nothing. So I think we can help to also tailor the plan to you. If you've got PCOS, your diet advice is going to be slightly different. If you have endo, it's going to be slightly different. Perhaps even if there's allergy or natural killer cells, we might tweak things a little bit there too. So get some advice. It's not, we're not going to make you eat nothing.
I do feel for some of the patients out there, and I do feel for some of the people who've asked this question, because again, not all nutritionists, dietitians, or naturopaths are created equal. The same way not all fertility specialists are created equal. So I see some patients coming to me and the poor things have been told they can never have another bit of sugar, they can never have another bit of gluten, they can never have another bit of caffeine, they can never have another bit of alcohol, they might as well give up and do nothing and go eat a salad. So I have heard that many, many times. And so I just want to be the patient voice that there are people out there doing this to our patients. So if you do have someone like yourselves who are a little bit more holistic, and I agree, reduce the sugar, reduce the inflammatory causing foods, reduce the caffeine, because we know, more than 2 shots a day or any 2 caffeinated beverages can reduce our chances of conception, increase time to conception, increase miscarriage. Smoking, no. I agree, some things are hard no. And McDonald's chips, does it really help your embryo implant? I've been asked that so many times. Do I go and eat pineapple cores till pigs fly? I don't know. So I get all these questions, and I agree that some things scientifically backed. Secondly, agree, please don't eliminate all food groups. And thirdly, some things have no evidence, but it may help your soul. So if you feel having those 10 McDonald's chips after the transfer, please do so. That in itself is not going to ruin everything. But as Ella asked, can you keep eating junk food and take a supplement to feel better? Probably not.
Yeah, I think it's it's easier to take a capsule, right? Like mentally, it's like you take the capsule. Oh, I did my fertility good thing for the day, and move on with your day. But it is sometimes more challenging to work on your diet and lifestyle. But the way that, and just going full circle back to what you started with, Manny, is this is not just 90 days before your egg collection, or 90 days before you conceive, or 90 days before you do XYZ. This is about the first 1,000 days of life. And that starts from 90 days prior to conception. But it takes you all throughout pregnancy. It takes you all throughout early motherhood and what you feed your child in the first 2 years of life. So you have to make sure you can do it for the long run. And restrictive diets, we know consistently don't work for the long run. And there are some restrictions that are medically necessary for some people, but for the majority of us, we can focus on adding things more into our diet. And I find most of the time, most of my clients are over restricting without any advice. And sometimes it complicates the picture. If you restrict gluten and you haven't been tested for celiac disease yet, that celiac test is null and void. It doesn't make any difference. And if you're going through fertility treatments and don't know if for sure if you have celiac disease or not, that can affect your outcomes. So don't cut anything out until you know for certain that you might need to, based on a medical necessity, rather than, oh, I read on Dr. Google that maybe gluten is inflammatory. No, don't do it.
I agree with you. I think I've had better results with patients putting things back in that they have removed themselves out of panic. I know I had one patient that, she just was eating salads pretty much all the time. And I think she was losing the essential fatty acids. We do need saturated fat in there as well, like in certain amounts. So I introduced fat healthily back into her diet. And this poor patient had had 3 failed IVF cycles. She'd pretty much thought she couldn't conceive naturally. Look, I made a few other changes as well, but within 2 cycles, she was pregnant, and I've seen her through breastfeeding, and she was being so restrictive. She was so stressed about her diet. She was almost counting everything that we just pulled back. We slowed down, we introduced some things back in, and that can make an incredible difference. So don't feel, if you are seeing someone who is making you count every calorie and restrict, as Manny said, please don't. That's not what fertility is about.
No. And you can shoot yourself in the foot as well if you over restrict and you get to energy intake being too low. And sometimes I see this with people who are trying to lose a few kilos before fertility treatments or trying to conceive. And if you go too low, you can just completely switch off that period. Poof, it's gone. And then you've got, no chances of potentially conceiving if you're trying to conceive unassisted, because you've got no cycle, you've got no ovulation. So it is a delicate balance, and you do need to really get support, particularly if you have, you're feeling this kind of stress. Your diet should not be that stressful. If it's causing you concern and you're thinking about it and you're researching and all that kind of stuff, don't even just put that and give it to a professional and let them take care of it. It is the biggest weight off your shoulders to do that. And as well, it just tones down your level of stress, knowing that someone else has got your back and is doing all the background work for you and is giving you the best advice possible for your unique situation.
What about the impacts of alcohol?
Alcohol.
You mentioned smoking, and that's a hard no. And you mentioned caffeine. But what about the impacts of alcohol? Do we cut that out completely?
I think it's such an interesting conversation to have. And I recently recorded a whole podcast on this topic, because ideal scenario is we should be abstaining from alcohol like we are pregnant in the lead up to conceiving. But there are certain situations where A, that might not be practical, or B, if you're meeting somebody who's been trying to conceive for the last 5 years, 10 years, many years, there's life that needs to happen in between: weddings, celebrations, graduations, all this other stuff that goes on with life. And it's often times that I get clients come to me being like, oh, I know I'm not meant to drink any alcohol, but I had a glass of champagne because it was my husband's birthday on the weekend. Do I need to start again? And it's not how it works. And so we want to minimize and try to keep below, say, a few standard drinks per week for women, and it's a little bit more for men. But ideal, sure, is 0. But is that practical for everybody all the time, maybe not. And so I just have a very like attitude of like, if you have a glass, don't beat yourself up. Don't delay your cycle by 2 months because you had a glass of wine. Like, just don't worry about it. Just keep going.
So it's not another 90 days then.
Yeah, no, it doesn't reset. As soon as you eat the chocolate or the wine, you don't have to go back to the beginning again. It's okay. You can keep going.
I completely agree with that.
Yeah. And almost give yourself permission. I tell my patients, look, if that dark chocolate, that glass of red wine on a Friday night is your thing, then don't, and often you'll have that bit of chocolate, then you just escalate and you'll go crazy, or you have the bit of alcohol, like, oh, I've done damage anyway, I'll just finish the whole bottle. You know what? Make Friday night your glass of red wine with your husband, with your meal, and that's going to calm your stress levels. As I said, make your life more enjoyable. I think we've got to look at those factors as well, the stress hormones. There's so much involved in this. It's not just the alcohol component. So yes, I agree with Stefanie. Look, in a perfect world, 0 would be great, but that may cause more stress. So, and if you're going to do it, sit down, embrace it, and enjoy that glass of red wine.
Absolutely.
That's exactly what I tell my patients. There's no
Yeah.
such thing as go binge and fall off a horse and go, I'm going to start again. It doesn't work that way.
No.
So moderation, if you want 1 glass a week or 2 glasses a week, make sure it's standard drinks and not a fishbowl pour.
Yeah.
Could fit a bottle in a glass, you know. But sit down with your standard drink, and as I said, the most important thing, as Tasha said, is to enjoy it. There's no guilt in it. You have decided that is what you would like to help, then don't go and think about it for 3 days. Enjoy it. That's part of it. It's fine. And
don't ruminate on it. I think that's the worst part of it all. Don't ruminate on the chocolate or the McDonald's or the wine or the life's too short. Let it go. Keep going.
We've got 5 minutes, and I've got a couple of questions. So is a low carb diet okay when you're trying to conceive?
To how low is low? And that,
I guess that's very broad.
Can't even agree on that.
And that, again, seeing someone who's going to help tailor that, I in general, I would say I don't like low carb diets, as in I don't like no carb to no carb diets. We need it for ovulation. We need it for healthy hormone production. Do I modify carbohydrate intake, particularly in PCOS? Yes. So, yeah, I think if you're looking at keto style diet, I don't know about you, Stefanie, but I'm not a big fan of those really restrictive diets. But modifying your carbohydrate, getting the right amount of carbohydrate, as Manny said, low GI, all those sorts of things can make a big difference. So I'd probably be putting up a hand up to see someone to see what's right for you.
Yeah. I mean, I think like something I always go back to, which is like a really hard and fast kind of guideline, is in a very low carbohydrate or low calorie diet, like a weight loss shake, which I would very rarely use. But just to give you a context of what they recommend, they say 6 weeks, at least 6 weeks prior to conception, you need to reintroduce carbohydrates, and it has to be grains, because we know that whole grains also play a particularly important role in implantation and uterine lining and providing fiber, carbohydrates, making sure your bowels are working. Your bowels aren't working, your hormone, leaving the building, excesses are not going to be as optimal as they should be. So it is like you have to think about it more than just, I'm just going low carb because I have insulin resistance. I'm going low carb because I want to lose a few kilos. Or it's a bigger system than that, and it's a bit more delicate than that. And as well, we don't recommend it for pregnancy. So if you do it and then you fall pregnant and you're going to reintroduce carbs, and that was the only thing that was helping you manage your blood sugar levels, you don't know how to manage it with it now. And now you're pregnant with the carbohydrates, with the blood sugar issue. So learn how to do it in a suitable, sustainable way that's also going to serve you if you fall pregnant and throughout pregnancy and beyond. That's how I look at it.
So definitely not keto diets. I agree.
No
keto. But as the ladies have said, look at the balance. So I usually say increase your good fats, increase your protein intake. So as a ratio, maybe. But as Steph also said, it's important to look at what carbohydrates and in balance, it may be reduced, but certainly not no carbohydrates.
Right. I've got one more question. Sorry, we're running out of time, and I've got quite a few messages. Tasha, what's the supplement that you have developed. What is it called?
Natal Nutrients is the supplement that I developed. It's available at zycia.com.au or through Tasha Jennings at my website, or through Slade's pharmacies. There are a lot of pharmacies next to the IVF clinics, particularly here in Melbourne, which is where I'm based. So yeah, you can find that at zycia.com.au.
And if anybody wants to talk more about the supplements, I'm pretty much sure that they can head over to your booth and have a chat to you in much more depth. And I know that you've got a network link that they can speak to you directly if they wish to.
Yes, I'll be available on Zoom, and I've got a presentation at 11:30 where I'll be talking about egg quality nutrients.
And if anyone wants to touch base with Stefanie and talk more about diet and nutrition, I'm pretty much sure they can head over to your booth and talk directly to you.
Yeah, the dietologist. Scroll right down the bottom.
Yeah, Manny's with IVF Australia, so I'm pretty much sure you can tap into her and head to the booth and speak to the ladies on the booth if you wish to get in touch with Dr. Manny Mangat. Now we've got 1 more minute. Is there anything else that you ladies would like to end on? Oh no, it's 10:15 now. Thank you so much.
Thank you.
Thank you so much, ladies.
Thanks,
45
Ella.
minutes went by so quickly. I can't believe.
We could talk fertility all day, I think.
I know.
Yeah.
Okay, thanks again for your time, and don't forget to head on to the next sessions, which will start in another 15 minutes at 10:30. There's quite a few, some in the main stage and in the breakout room. If you haven't done the polling, if you could just click on the poll and do the survey, that will be fantastic. Thanks so much for joining us. Take care.
Thanks, everyone.
Bye, ladies.
Thanks, Stella. Good luck, everyone.
Bye.
Bye.